Assalamu alaikum warahmatullahi wabarakatuh. Today we will talk about pathology of immune system. Diseases of the immune system either include hypersensitivity or hyperreactivity reactions, including autoimmune disorders, or maybe include immune deficiency state or immune compromise, immunosuppression states. يعني أما يكون هايبر اكتيفيتي وهايبر سنسيتيفيتي، أو أنه يكون immunosuppression أو immune deficiency. Immunosuppression or immune deficiency. Hypersensitivity may include autoimmune disorders. Hypersensitivity reaction occur as one of 4 types, each of which has a different mechanisms. عندنا 4 type of hypersensitivity: type 1, type 2, type 3 usually mediated by antibody-antigen reaction, while type 4 mediated by cellular mechanisms. عندنا type 1 hypersensitivity أو يسمونها immediate hypersensitivity. mechanism of type 1 hypersensitivity: after first exposure to an antigen اللي هو الالرجين نسميه، اما يكون الداست او البولين حبوب الطلع او الهير and so on, result in first exposure to these allergens result in formation of specific IgE for this allergen. And after exposure of antigen to CD4 T cells, this will stimulate CD4 T cell to differentiate into T helper 2 cells. قلنا احنا CD4 after activation may differentiate into T helper 1 or T helper 2 T cell. Type 1 hypersensitivity, exposure of antigen to CD4 will stimulate them to differentiate into T helper 2 cells. T helper 2 cells in turn will release interleukins, different interleukins, including interleukin 4 and interleukin 5. Interleukin 5 will stimulate eosinophils, and interleukin 4 will activate IgE producing B cells. And this IgE, immunoglobulin E, binds to mast cell or basophils اللي هاي يعتبرها السيتوفيليك IgE antibody اللي have a specific receptor present on their surface, binded with يعني have ability to bind with IgE immunoglobulin. هذه الخطوات كلها بعد first exposure. Subsequent exposure for the same antigen, subsequent exposure and binding to the same antigen bind to IgE bound to mast cells result in degranulation of these mast or basophils and release their mediators, particularly the histamine. اللي قلنا هو يعتبر vasoactive amines, pre-existing mediators present in mast cell granules. The release of mediators, including histamine, causes increased vascular permeability, and this will result in leakage of fluid, leading to edema and increased smooth muscle contraction, and eventually lead to a bronchoconstriction in respiratory passages. عندنا phases أو steps of immediate type hypersensitivity. early phase والlate phase. early phase يعني start within 5 to 30 minutes after exposure, characterized by vasodilation, vascular permeability, smooth muscle contraction, طبعا أكيد due to binding of IgE و degranulation of mast cells and release their mediators. late phase اللي هو occur after 2 to 24 hours and may يعني continue to days, characterized by infiltration of inflammatory cells, different type of inflammatory cells including neutrophil, eosinophil, basophil and monocyte, and result in mucosal damage due to release of their mediators of these cells by these recruited cells. Form of type 1 hypersensitivity أما يكون systemic effect مالته systemic anaphylaxis or localized مثل اليورتيكاريا الهيز. systemic يعني for example parenteral administration of antigens, for example a bee sting or reaction to penicillin. هاي دائما يكون الإفكت مالته يكون systemic reaction. ويكون consequence مالتها generalized including all or whole the body, usually result in death due to يعني severe airway comprises from laryngeal edema. localized يعني دائما هاي تكون life threatening. localized effect مالتها مثل اليورتيكاريا يعني affect upper respiratory tract or skin, only the skin. clinical presentation مالتها occur with 30 minutes of exposure to antigen including الراش السكين يكون كلش واضح, nausea, vomiting إذا كان يعني الجي اي تي sensitivity for certain food, facial swelling إذا كان بالسكين يعني يصير رش swelling بالسكين, wheezing وسترايدس صرير وصفير إذا كان يعني involving upper respiratory passage أو respiratory passage ممكن يكون hypotension, severe hypotension and tachycardia. البايوماركر هو السيرم tryptase. serum tryptase is a biomarker of anaphylaxis يعني type 1 hypersensitivity or anaphylaxis. هاي الفيجر illustrate the mechanism of type 1 hypersensitivity خصوصا بالانافيلاكسيس يعني mediated by anaphylatoxins اللي هي تعتبر يعني complement peptides و complement component. فالactivation of mast cell by complement component C3AC5A نسميها الانافيلاتوكسين اللي فد specific receptor on the mast cell نسميه الانافيلاتوكسين receptor. This will activate mast cell after combination with their receptors in combination with antigen antibody reaction on the surface of mast cell induce activation and degranulation of mast cell result in releasing of histamine pre-existing in their granules and newly formed chemical mediators, for example the prostaglandins, leukotrienes, thromboxane A, وكل واحد له فد specific effect. ممكن انه يسوي لنا smooth muscle contraction or increase vascular permeability, او ممكن انه chemotactic attractant for eosinophils or may يعني produce proteases proteolytic effect. This is a typical example of skin form أو urticaria and about type 1 hypersensitivity, immediate type hypersensitivity characterized by swelling of skin due to edema, and the edema resulting from increased vascular permeability induced by histamine or complement components and the cardinal signs of acute inflammation is clear, characterized by swelling and redness. لأنه الهايبرسنسيتيفيتي تعتبر يعني one type of inflammation، يعني induced يعني hypersensitivity immune inflammatory process. فيعتبر قلنا احنا الكوزز، احد الكوزز اوف انفلاميشن هو الاميون ديسوردرز، فهنا يعني تعتبر as typical example about the inflammatory process، hypersensitivity inflammatory process. عندنا type 2 hypersensitivity reaction، antibody for example IgG or IgM يعني if directed against target antigen on body cells or in extracellular matrix. The target antigen may be endogenous or exogenous. ممكن أنه يكون endogenous directed against مثلا الانتيجين surface antigen of RBCs ويسوي لنا autoimmune hemolytic anemia، أو أنه يكون exogenous مثل حالة erythropoiesis أو blood transfusion incompatibility، blood transfusion يعني between blood groups، incompatibility between blood groups between donor and recipient. الميكانيزم مالتها الميكانيزم either mediated by complement dependent reaction where the antibody antigen complex activate and fix the complement system, causing a direct cytolysis of by a membrane attack complex, inducing cytolysis or direct cytolysis by immuno membrane attack complex اللي هي هذا السيستم أو من يعني يعتبر complement component. قلنا من C5 للC 9 of complement system activated by antibody antigen. ممكن أنه يسوي لنا pouring rolling in the cell surface target cells and induce cell lysis, or may be mediated by opsonization of the target cells by C3b. والأوبسونين هذا يعتبر cover the target cells and induce or induce or help phagocytic cells to phagocytose these target cells. For example, glomerulonephritis, autoimmune glomerulonephritis may be mediated by this mechanism. Sometimes يكون الميكانيزم antibody dependent cell mediated cytotoxicity. مثلا عندنا السيل اللي هي peering receptors يعني specific for FC portion of IgE، لأنه ال IgE immunoglobulin بيفد portion يسمونه ال FC من خلاله يعني يسوي يعني connection و binding على ال specific receptor اللي موجود على different cells such as neutrophil, eosinophil, macrophage and natural killer cells, and this will mediate moving of this antigens. مثلا عندنا هاي بحالة الترانسفيوجن reactions، بحالة incompatible blood group between donor and recipient erythroblastoses fetalis or autoimmune hemolytic anemia، يكون اكو فد specific يكون فد يعني specific receptor لل FC portion of IgG و induce neutrophil, eosinophil, macrophage to remove this antigen. Sometimes may يعني mediated the mechanism by antibody mediated cellular dysfunction. antibody mediated cellular dysfunction مثلا عندنا بحالة الautoimmune diseases مثل Graves disease والماستينيا gravis، يكون الانتيبودي themselves affect the function of the antigen يعني either positively or negatively. For example, in the Graves' disease is due to an antibody, and this antibody activate directed يعني bind with thyroid stimulating hormone receptor and resulting in activation of this thyroid stimulating hormone receptor and lead to increase or hyperthyroidism. hyperthyroidism لأنه يكون الأكشن أو الفانكشن of this antibody mimic or similar to action of thyroid stimulating hormone وبالطبيعي المفروض يكون الثايرويد ستيميوليتنج هرمون يعني يرتبط بالثايرويد ستيميوليتنج هرمون ريسبتور مالته ويسوي لنا يعني stimulate thyroid epithelial cells to produce the hormone. بينما بحالة هذا الجريفز ديزيز يكون اكو فد اوتو انتيبودي ويسوي لنا binding activation يعني uncontrolled binding activation of thyroid stimulating receptors فيصير uncontrolled hyperthyroidism. In contrast with myasthenia gravis where there is يعني الانتيبودي الاوتو انتيبودي يكون directed against acetylcholine receptor and يعني impairing neuromuscular transmission لأنه يكون يعني not similar or not mimic to the يعني action or activity of acetylcholine function فيسوي لنا only blocking الانتيبودي هنا راح يسوي لنا only blocking للacetylcholine receptor and impairing of neuromuscular transmission. عندنا هنا example about type 2 hypersensitivity عندنا مثلا example of RBCs وعليها قد الانتيجين مالتها يجي الانتيبودي directed IgM for example directed against the self antigen present on RBCs حالة مثلا for example an autoimmune hemolytic anemia forming immune complexes antigen antibody complexes will activate complement system particularly C5 to C9 اللي هو membrane attack complex attached to the RBC membrane inducing holes or fragmentation in cell in RBC membrane resulting in evaporation of hemoglobin and electrolytes and other components resulting in cell lysis. This is most of the mechanism in autoimmune hemolytic anemia or blood transfusion reaction or erythroblastoses fetalis. And this other example about type 2 hypersensitivity حالة الجريفز disease حالة الجريفز disease اللي قلنا يكون الانتيبودي attached to thyroid stimulating receptor ويكون mimic يكون induce activation of thyroid epithelial cells resulting in produce excessive hormones and hyperthyroidism. In contrast, in the case of myasthenia gravis يكون الانتيبودي يعني inactivate or block the acetylcholine receptor preventing the acetylcholine to bind with its receptor and resulting in failure of neurotransmission muscular neurotransmission. Hypersensitivity type 3 or type 3 hypersensitivity reaction mediated by antibody, for example IgG, IgM, and occasionally IgA antibody, where this bind to the antigen forming an immune complexes مثل ما قلنا type 1, type 2, type 3 mediated by antigen antibody complexes. In this type, the antigen can be exogenous, for example viral protein, or endogenous يعني self antigen, maybe DNA or histone protein, the protein of DNA. And this immune complexes can form in cyto يعني localized تكون يجي الانتيبودي يعني directed against the self antigen in cyto، يجي بمكان اللي يستهدف الانتيجين مكانه يعني نفسه يكون localized. Or they can form in the circulation، يتكون antigen antibody يعني in the blood circulation، و then يعني يكون deposited in different organ in the body where they cause damage to different organ and tissue through the body. The immune complex causes activation of the complement cascade. دائما الاميون complex يسوي activation of complement system and accumulation of different type of inflammatory cell, particularly polymorph nuclear leukocyte. The immune complexes normally are يعني commonly formed for various reasons, but only under certain circumstances do elicit the immune reaction, unwanted immune reaction. Immune complexes أكيد mediated vasculitis and form glomerulonephritis as example. يعني mechanism of type 3 hypersensitivity مثلا بحالة الأوتو immune antibody يكون activation of polyclonal B cell hyperactivity resulting in auto-antibody protection anti-double stranded DNA، لأنه قلنا أحد إنه يكون الاندوجينوس DNA antigen هو DNA أو الهستون، فيكون immune complex formation in circulation and deposits in different or in tissue resulting in tissue injury, for example glomerulonephritis, vasculitis, serositis, arthritis. مثلا بحالة osteoarthritis, rheumatoid arthritis. Example about typical example about type 3 hypersensitivity is systemic lupus erythematosus, characterized by red rash on the malar eminence and on the cheek below the eyes and across the bridge of nose, forming a butterfly rash in the skin. هنا عندنا هو التايب 3 قلنا هو البيزك ميكانيزم مالته هو انتي بودي انتيجين كومبلكسز. بحالة ال SLE systemic lupus erythematosus يكون auto antibody directed against endogenous antigen against the DNA against the histone protein ويكون circulating may circulating or يعني يكون directed against or localized in cyto directed against a different tissue and organ in the body. هنا ال clinical manifestation مالته expressed in the skin particularly in sun exposed area لأنه دائما تكون بال sun exposed area ال SLE inducing severe damage in skin layer. هنا عندنا ال SLE involving the splenic white bulb. associated with peculiar periarteriolar fibrosis in the spleen, forming onion skin lesion يسمونه onion skin. هي عبارة عن multiple layers or thick layers of fibrous connective tissue around the arteriole, central arteriole, يسمونها onion skin lesion. This أكيد result from chronic irritation or chronic neurological damage to splenic white bulb due to autoantibody directed against self-antigen affecting the splenic tissue. بالكرونيك أكيد قلنا راح تصير يعني formation or activation of fibroblast producing the collagen fibers. عندنا type 4 hypersensitivity reaction اللي هي mediated by T cell. هي the only one type that mediated by cellular mechanism, particularly by sensitized T cells. الميكانيزم delay form مالته يكون CD4 T helper cells, particularly T helper 1, sensitized from previous exposure to antigen and secrete interferon gamma. Interferon gamma activate macrophage. Activated macrophage secrete interleukin 12. هاي العلاقة اللي قلنا reciprocal relationship between T helper 1 والmacrophage. Interleukin 12 result in activation and differentiation of T helper 1 again, and this will continue for a long time, resulting in activation of fibroblast. Fibroblast produce excessive extracellular matrix, including collagen fibers, and activation of macrophage to يعني persistent activation of macrophage result in granuloma or يعني formation of granulation tissue characterized by collection of epithelioid histiocyte. The causes of this type of hypersensitivity, typical example مالتها هي الجرانيولوما اللي أخذناها بالكرونيك inflammation. وعندنا بعد other type هو sarcoidosis اللي راح ناخذه as example. الكوزز مالتها مايكوبكتيريا مثل مايكوبكتيريوم tuberculosis، ممكن انه الفنجاي ممكن انه يكون causes of delayed type hypersensitivity، ممكن انه يكون parasite، ممكن انه يكون foreign body and so on. وممكن انه تكون الميكانيزم مالته يعني by cell mediated cytotoxicity where the sensitized CD8 T cells kill the antigen bearing cells أو antigen containing cells. The antigens represented by class 1 major histocompatibility complex for T cell, and the CD8 T cell will call this antigen bearing cell. Mechanism of this cell mediated cytotoxicity mediated by porphyrin enzyme system, where the porphyrin produce hole in the plasma membrane of cell, and the NGRA enzyme will activate apoptosis. Or sometimes activated the apoptosis by phase with a phase ligand system. Sensitized T lymphocyte have phase ligand which bind to phase on the target cells, leading to apoptosis activation of apoptotic process. Sarcoidosis is the typical example about the delayed type hypersensitivity, type 4 hypersensitivity. طبعا الكوزز يكون unknown واكو فد similar or comparison between sarcoidosis and الجرانيولوماتس reaction أو الجرانيولوما اللي أخذناها بالكرونيك as example of chronic inflammation. يكونوا الاثنين عبارة عن chronic inflammatory reaction و include aggregation of mononuclear cell, particularly macrophages, activated macrophages, epithelioid cells, lymphocytes containing or surrounded with massive fibrosis, or sometimes يعني يكون حتى sarcoid containing multinucleated giant cells. But the differences between the sarcoid and a granuloma is there is no center of caseous necrosis. There is no center of caseous necrosis in the case of sarcoid. In addition, the causes in the sarcoid يكون دائما unknown. The causes of sarcoid يكون unknown. بالإضافة إلى أنه يكون يعني lack of the center of caseous necrosis مع intermediate magnification مع high magnification. No central necrosis, mononuclear cells including lymphocyte, epithelioid cells or macrophage, activated macrophage, fibrous connective tissue, but there is no center of caseous necrosis. مع high magnification illustrate different type of inflammatory cells including lymphocytes and macrophages and epithelioid cells. Transplantation pathology or transplant rejection of transplanted organs. Maybe a rejection of transplant organs may be mediated by cellular or humoral immunity. Cellular by T cells or humoral by antibodies. With cellular rejection mediated by T cells and humoral rejection mediated by antibodies. It may be classified based on its time following the transplantation process. The rejection can be hyperacute, acute, or chronic according to time after transplant rejection. Maybe hyperacute, acute, or chronic. Cellular rejection is due to hypersensitivity of the recipient CD4 T cells, which results in killing of graft cells, resulting in killing of grafting cells or transplant organ cells by CD8 T cells, أو اللي هي نفسها نسميها cytotoxic T cells that have matured into cytotoxic T lymphocyte which kill graft or organ transplant organ cells through the porphyrin enzymes pathway or bypass ligand pathway. يجي البورفرين يسوي pouring بالgraft cells ويدخل الجرا enzyme inside the cells inducing apoptosis ومرات لا by activation between phase ligand على cytotoxic T cells والفاز على target graft cells يسوي لنا activation للapoptosis. Humoral rejection is due to preformed antibody, either preformed antibody or formation of new antibody against graft vasculature, Classification upon time following the transplant procedure. يا اما يكون قلنا hyperacute or acute or chronic. Hyperacute rejection usually or mostly mediated by humoral reaction due to a preformed antibody directed against graft endothelium. يعني اكو فد مسبقا مكونة اجسام مضادة ضد الاندوثيليوم مالت الجرافت اورجان. pre-formed antibody to graft endothelium occur after minutes followed the transplantation و sometimes يكون يعني directly يعني during the surgical procedure خلال العملية ممكن انه السيرجيان يحس انه اكو فد rejection. grossly the rejected organ appear as cyanotic يعني cyanosis يبين الأورجان. microscopically there is endothelial injury, severe endothelial injury, neutrophilic infiltration particularly in arterioles and يعني arterial intima, and infarction of parenchyma of transplant organ. هاي في حالة الهايبر أكيوت. في حالة الأكيوت الميكانيزم either mediated by cellular or humoral reaction occur after days or months or years after يعني following transplantation. microscopic appearance of acute cellular rejection characterized by interstitial mononuclear infiltration, edema, endothelial hemorrhage, and endothelialitis, while the microscopic appearance or feature of acute humoral rejection could be characterized by endothelial injury and necrotizing vasculitis neutrophilic infiltration to the vessels and infarction of parenchyma. تقريبا هنا نفس الفيتشر microscopic feature of hyperacute. هنا عندنا example about acute cellular rejection in the kidney characterized by massive lymphocytic infiltration invading the glomeruli and renal tubules of a graft or transplant organs. عندنا الثيرد تايب هو chronic rejection. الchronic rejection mechanism بالchronic rejection mostly mediated by cellular rejection occur after 4 to 6 months to years followed graft process or transplant process. Microscopically characterized by vascular changes, massive interstitial fibrosis. هاي يعني الباثوجنومونيك فيشر مالت الكرونيك ريجكشن تكون، والوحيد هو يتميز بها بأنه يكون presence of interstitial fibrosis. In addition to massive interstitial mononuclear infiltration and ischemia with subsequent tissue loss. This figure shows different type of rejection. In the A, this typical example about hyperacute rejection characterized by infiltration of neutrophils, يعني infiltration of neutrophils for graft organs and inducing fibrin platelet thrombi in the vasculature of graft organs. Figure B illustrate typical example about acute cellular rejection characterized by massive infiltration of mononuclear cells into affecting the renal tubules, and in the center this artery will appear with severe inflammation of the internal layer which appear invaded with inflammatory cells and thickening of this arterioles. Figure C illustrates the example about the chronic rejection, chronic rejection, stent with a special stent, illustrate the fibrosis or massive fibrosis and the renal tissue, particularly in the cortex, renal cortex. And اكو thickening بالinterstitial tissue due to formation of fibrosis. هاي كلها اللي stand with red يعني stand with blue stand كلها هاي represent fibrous connective tissue induced in a chronic rejection process. In addition to presence of mononuclear cells. يعني بس ال characteristic feature of chronic rejection هو العلامة المميزة له الماركر هي الهالمارك هي presence of fibrosis. السلام عليكم ورحمة الله وبركاته.